All right, everybody, welcome to the first short segment on describing lesions. This is going to be an introduction to pathology for the layperson. I've simplified these concepts, or at least the concept we're going to go over today, just so hopefully more of you could understand it. You don't have to have a medical background, and by all means, this is not intended to diagnose or treat any sort of disorder. This is just for purely educational reasons and purposes. And today we're going to talk about describing lesions. What are the criteria that are involved? Let's see. Hello, everybody. Welcome to the very first short segment. Today we're going to talk about describing the lesion, and particularly one aspect of describing lesions. So this is intended for educational purposes only. This is obviously not intended to diagnose or treat any sort of disorders. And I will caution you that there are going to be some graphic images on these presentations as well as the following ones. My name is Veronica King. I am an anatomic veterinary pathologist as well as an assistant professor, and so my love for pathology means you get to learn. Yay! So the first thing to stress is when you are describing lesions, there's a couple different things that you need to make sure that you indicate. So why you would want to describe lesions is anytime that you are submitting a tissue or a biopsy for diagnostic purposes, like to the pathologist, in order for us to diagnose, we need to be able to know what that tissue looked like before you took it out. And so some of the concepts that we're going to go over in the subsequent PowerPoints are going to include things like anatomic location. So I'm going to go into this in much more depth in subsequent presentations, but this is basically where is the lesion, and not just that, as specific as possible. Another thing that you want to include in your descriptions is size, something called distribution, which again we will go over in a later presentation, shape, color, contour, texture, smell. Yes, smell, believe it or not. There are some diseases that have very unique smells to them. And then lastly, weight and volume. So today we're just going to focus on contour and specifically just raised lesions. So when you have a raised lesion, I like to think about it like this. So let's say that you have your hand held out and you're looking to get paid, right? So we have a dollar bill that's laid in our hand. If we were to add more dollar bills to that, what happens to that stack of dollar bills? It gets larger, right? So with lesions, it's the same sort of concept. So if you're adding something to a cell or adding something to a tissue, that tissue or cell is going to be raised. Okay, so a raised lesion means that there is something being added to the cell or the tissue. And we'll talk about what kind of things can be added. But again, just simple example, if you're adding $1 bills to a stack of $1 bills, that stack is going to get larger. Lesions are the same way. So the first thing that can get added are cells themselves. So if we have a cell and we have other cells that are being added to the tissue, overall the tissue is going to get larger and the lesions can get raised. So this can be one, obviously not one cell, but thousands of cells, hundreds of thousands of cells. But the more cells that we add to a tissue, the larger it's going to get, the tissue. Now, it doesn't have to necessarily be raised in the same sense that it can actually be side by side. So we got to talk about this in 2 dimensions, but really this is happening in 3 dimensions. So if you're adding something to a tissue and that something has to be, other cells, what's going to happen is you're going to add more cells to a tissue and the tissue itself is going to get larger. The other thing that you can add is fluid. And this can be lots of different things. So things like blood or edema, exudates like pus, all sorts of nastiness. How that happens is you can accumulate fluid either within a cell. So if we're pretending that these are each individual cells, so you can have things fluid accumulate within those cells, or you can have fluid accumulate outside of those cells or between those cells, or sometimes both. So what does that look like? Well, here's our stack of cells, and let's say that we are adding fluid to the cell, inside the cell. What's going to happen is we're adding something to a tissue or a cell, and the cell is going to get bigger. Okay, so if the cells are getting bigger, that means the tissue is getting bigger as well. The other thing that can get added to cause a raised lesion is gas. Again, like fluid, this can be accumulation of gas within a cell, inside a cell, or between cells. So let's just imagine that we have, let's go back a little bit. Let's just imagine that we have balloons, okay, and these balloons are going to represent cells. So if you've got balloons or cells and you're adding gas inside that cell, what's going to happen? We're adding something to a cell or a tissue, the tissue is going to get bigger. In this case, we're adding gas to a balloon, the balloons are going to get bigger. Now these are all different sizes because to keep in mind it doesn't always have to be equal amounts. So you may have some cells that accumulate more gas or more fluid than other cells. It doesn't have to be equal amongst all the cells. But the thing is that regardless, if you are adding something to a majority of the cells, you're adding to that tissue and that lesion is going to be raised or bigger. Okay, you can also have cellular products. So if you're adding cellular products, what does that mean? Well, cells can produce certain byproducts. They produce them internally in the cell and then they ship them out of the cell to get deposited outside. Well, sometimes what happens is cells, lots of different cells, can actually take things inside of them. So if you're thinking about medical jargon, let's talk about the macrophage. The macrophage is a phagocytic cell, meaning it basically looks like Pac-Man if you think about it. Pac-Man goes around on his little, game board trying to eat all the little dots and the ghosts. So here's the same sort of concept. So let's say that we have a cell here, and we have these particles, and these particles get brought into the cell. What's going to happen? Well, if the cell cannot get rid of these particles fast enough or at all, you're basically adding more things to the inside of the cell than it can get rid of. So the cell's going to get bigger. Now this can be lots of things. So this cell keeps bringing these little squares or cubes into the cell, and the overall effect is that the cell is going to get bigger as well. Now let's imagine here's a cell here, and let's just say that this is a tissue. Okay, so cells can bring things inside of them, and if they can't break them down or they can't get rid of them faster than they bring it in, you're going to have a net accumulation of things in the cell, and that cell is going to get bigger. But let's say that the cell makes stuff and it starts making things in excess. Doesn't really matter what it is, but just for demonstration purposes. So if this cell is making stuff and it's shipping out of the cell, so here's our products that our cell is making, now we're shipping it out of the cell. Again, if we start depositing and adding more of something to the tissue, the overall effect is that the tissue is going to get bigger. Okay? So you can have accumulation happening within a cell and accumulation of stuff happening outside of the cell. again, the net result is that the tissue or the cell is going to get bigger. You're adding something to a tissue, adding something to its cell, the cells or the tissue is going to get bigger. I apologize for these. I do not do human anything. This is gross, but I took these off of Wikipedia, so they're in the public domain. But just to give you some examples. So here we have a vesicle, which you probably know better as a blister. Well, if you can see, we have a raised lesion, right? Something is being added to this tissue. So what does that mean? Well, we just learned that the things that can be added to the tissue can be things like cells, fluid, gas, or even cellular products. So in the cases of vesicles, this is actually an accumulation of fluid. So we're adding fluid to a tissue, the tissue is going to get bigger, and we're going to have a raised lesion. On the other hand, it doesn't have to be necessarily fluid. Here we have an example of a pustule. So if you can see, we have some raised lesions here, right? It's kind of raised above the skin, which means something is being added to this tissue. What is being added? Well, as we know, things like fluid, gas, cells, or cellular products can be added to a tissue to make that tissue bigger. Plus, if it's on the surface, it can cause raised type lesions. So here we have an example of pus. So pus is basically dead and dying neutrophils that are responsible for getting rid of bacteria. So we have an accumulation of neutrophils in an area, which means we're adding more cells to that area, which means that area is going to result in getting bigger. And since this is on a superficial level, it's going to have raised type lesions. Here's another example. So this is another something you see in vet med very regularly. This is called an oral hematoma, okay, which basically means that we have blood accumulation in the ear. Okay, so if I didn't put a normal picture of a dog ear, but hopefully you guys all know it's pretty flat, right? So this tissue is raised. The whole thing is really thick, right? And the reason being is that something is being added to that tissue. And so in this case, it's actually blood. So there is blood filling this sort of pocket within the ear. And overall, what happens to the tissue when you add something, it gets bigger, right? And you can even see it starting to get a little bit kind of extended, raised type of lesion, whereas normally dog ears are pretty flat. Here's a picture of a tumor. This is taken off of Wikipedia, so sorry, this is probably human, gross. But here we have a tumor here, and you can see that we have a raised lesion. Okay, here's the normal-ish mucosa of probably the colon, and we have this kind of raised area. Well, what do you think about when you have raised areas? You think about something being added. Now, what can be added? Again, fluid, cells, gas, cellular byproducts. Okay, well, I'm telling you that this is a tumor, so we already know what is causing this lesion to be raised, and that's the addition of multiple new cells. So if we're adding more cells to a tissue, like tumors, that tissue is going to get raised and thickened. Sorry to put a picture of food. They always say don't ever use food when you're talking pathology, but then they always use food as examples, so sorry about that. But here we have an example of gas. So this is actually obviously not, this is a contrast study of the lung, but you can clearly see that one lung is smaller than the other lung. Well, what that means is if this lung is larger than this one, something has to be added to it, right? So you go through your same old list. So what kind of things can get added? Well, it can be fluid, it can be gas, it can be cells, it can be cellular byproducts. So in this situation, this is actually emphysema, which is gas. These are pockets of emphysema. that you see in this part of the lung, but you don't see so much in this part of the lung. So what's happened is we actually have added gas to the lung, and we're adding something to a tissue. The tissue is going to get bigger. Okay. I put this bread in here because that's kind of what it looks like. If you were to cut the lung and look at it, you would have these pockets of air, essentially. That's pretty much what it looks like when you cut it open in a lung that has really bad emphysema. Okay, here we have an example of a bovine lung. And just to the right, I put a more normal-ish picture. This is a pig lung. And it's not the same orientation, so that's why it looks a little bit different. But what I want you to look at is the color. Okay, normal lung is pale pink in color, or light red, and it should be pretty smooth. This lung that we're looking at here, you can see all throughout the lung are these little kind of raised circular lesions. Well, when you see raised lesions, you think about things being added to a tissue. Now, those things can be things like fluid, gas, right? Cells, cellular byproducts. So this is actually an example of an emphysematous lung. So all of these little bumps that you see are actually little pockets of gas. And not only that, but they're also in the interlobular areas of the lungs as well. So here's where you have all your alveoli, here's where you have your interstitium. So this is just basically connective tissue that normally isn't this prominent, sometimes more like this. Normally you can barely see it, but here on this cow, because there's so much gas getting added to the lung, things get bigger, right? If it's a space, that space is going to get bigger. So all of these areas, these interlobular septae, these are all emphysematous, and then there's lots of emphysematous bulla scattered throughout the lung. So if you think about what this would feel like, think about bubble wrap. So it would feel light, airy to an extent, and when you cut it open, again, it will kind of look like this. And that concludes our little first talk about describing lesions. I'm going to do these in short segments. Each one of these observations that we talked about, I'm going to go into more detail in subsequent presentations, but just to let you know that today we just focused on contour and raised lesions. The next time we will talk about depressed or flat lesions. So you can probably already guess that if you're adding something to a tissue, the tissue is going to get raised. If you're taking something away or something is lost from a tissue, you're going to result in a depressed lesion. So we'll talk about that a little bit later on a next presentation, and then I'll come back again and I'll give you some more information on what all this other stuff means. All right, guys, thanks for joining. Hope you had a good time. Let me know if you like it, if it's helpful.